Good evening, ladies and gentlemen. Thanks a lot for being with us tonight. Cible Formation in partnership with Philorga. Tonight, you are assisting a live training about the BioNutriLift protocol, or how to lift and revitalize in one single gesture with a cannula. You know that you can ask questions with the web live chat anytime on our website. We will be delighted to answer it live directly. We've been today followed from all over the world, so I will just make a quick introduction for our Spanish speaker audience. Señoras y señores, muchas gracias para estar con nosotros esta tarde. Estamos hablando desde París. Esta noche estamos haciendo un training a propósito del tratamiento, el protocolo BioNutriLift. Muchas gracias por su presencia. Por favor, pregunta any preguntita que tendrían sobre nuestro sitio web con el web chat. Y muchas gracias para estar con nosotros. Nous avons le plaisir, and we have the pleasure tonight to welcome Dr. Philippon. Welcome,
Hello,
Doctor.
Quentin.
She is one of the most renowned and expert aesthetic doctor in Paris, France. Please enjoy the show, and Dr. Philippon, the floor is yours.
Thank you. Hello, everybody. Dear colleagues, I have the pleasure and the honor to present you the BioNutriLift protocols. And let me introduce the patient we're going to treat tonight. So tonight, Capucine is this wonderful woman of 60 years old. She's still active. She's today the mother of 3 children, and she also have 4 grandchildren. Capucine has already had some procedure. She had some volume in the cheek and also in the mandible line. Her concern is to maintain a healthy life, and her concern is also to have a kind of preserving the contour face. The BioNutriLift is a very good indication according her skin, according her wish, because it will, in one session, create first a kind of lift effect and also remove this kind of fine wrinkles. So I'm going to present you the BioNutriLift is realized with 2 products in one single session. First, the fine lines, as you can show on the screen. Fine lines, which is HA, artificial fine lines, very low reticulated, very smooth, and combined with NCTF 135 HA, which is a biorevitalization product of more than 59 ingredients with free HA. We are going to combine these 2 products in one single session with a cannula. The cannula is a 25 gauge cannula, 60 millimeter. So I'm going first to present you the protocols by drawing what we're going to do. And the first thing is to determine the entry point. I will do what I called a duo, that is to say an upper vector and a lower vector. The upper vector, I will determine the entry point according, the area I wanted to treat. And so I will start here. We will use a fanning technique, and in retrograde technique, deposit some fine line 0.5. Inside, then, we will proceed to deposit NCTF 135 HA 1.5. For the lower vector, we will enhance the inferior part. We will proceed to the same protocols, BioNutriLift, and we'll start here on the mandibular like this with 3 vectors. So I will use for this side 1 ml of fine line, 0.5 upper, 0.5 down, and 1.5 NCTF, 1.5 NCTF. It is very important to prepare on your plate the 3 ml of NCTF that you have in this syringe and your cannula on the fine line first, because we will always start the BioNutriLift with the fillers, the fine lines in this case. In some cases, For example, when your patience is more marked, you can use universal 0.5. So let's start with the entry point. And one key point of the Bunito lift is to be very superficial. That is to say that your entry point will be very superficial, as you can see. Are you okay, Capucine? Okay, good. Usually, this procedure is not painful. You just have to prepare your patient to say that she could have some uncomfortable when the cannula is in the skin. So, I will introduce very superficially, the cannula. And the Bunito lift has these wonderful benefits to use the 3 benefits of the tools. First tool is the cannula. And the cannula by itself, very superficially, will help to defibrosis. Okay? Then we will inject here, from the upper part of the nasogeneal group, a little drop of fine lines, very little drop, and deposit 0.1 ml very slowly of fine lines. Then, using the fining techniques, I will go, down to this part of the nasogeneal groove, and I can help with my finger, to take advantage of the length of the cannula, and I will deposit another 0.1. Okay? Then I can move around in order to be very comfortable with my cannula, always very superficial, look, and I arrive here. So you see the benefits of the Bunito lift is certainly to smooth the line, to have a lift effect, but it will be in 6 months majority lift effect, not immediately, and also, to treat the shadows. I like not to switch off my cannula, and I prefer, to leave it inside. That's why I like to prepare in the plate, already NCTF 135HA, and I will place immediately in between the fanning with the same fanning technique, retrogradely, the NCTF. I will first of all defibrose this a little, and look, I will put 0.5, 0.5, and 0.5. This is the more classical Bunito lift protocol you can do for lots of your patients who want refreshing, and to create not too much volumizing, but to rehydrate and on the long-term basis to enhance the quality of skin and also to take benefits of the collagenase induced, as it has been demonstrated in the clinical study published in Dermatology Surgery with fine lines and universals, the neocollagenase that we know will be massive at 6 months till 18 months. So I would like that Capucine can be seen to see, just focus on this part, please, the first result we can have with the Bunito lift upper. Okay? Look, it's difference. Now, to treat this part, we will use exactly the same protocols. Okay? Please, just one thing. Think to change your cannula to the fine lines. Why? Because the fine lines will offer, the possibility to the NCTF to remain inside the fanning. If you start with the NCTF, with the under-revitalization techniques in cannula, it will be spread in the dermis, superficial dermis. If you first start with the fine lines and you put the NCTF in beside the fining, you will have much more a lift effect. Here, you know, it will be very interesting for Capucine because she has a bit of elastosis. So it will allow the Bunitral leaf, which is an exclusive Filorga protocols, to take benefits, to treat the elastosis here, and also to have this lift effect, which matches the expectations of Capucine. So I will repeat again exactly the same steps of the protocols. That is to say, first, entry point. It is a 25 gauge needle. We do use a soft fill, which is Cannula, which is a good, well balanced in terms of flexibility. Okay, so once you've done the entry point, very parallel, you maintain your cannula in the same plan, very parallel. Are you okay? Well, the needle of the soft fill is the same gauge of the cannula. Maybe I prefer to do it again very softly. Okay. I remain the points very, very superficial. We can see that it is quite well the elastosis, very well fibrosis, and I take advantage in this protocol of Bunitral lift, not only to treat the elastosis, but also to treat the upper part of the lips. I deposit very slowly 0.1, then I change the direction, and I can go here, you know, at the corner of the mouth, 0.1. Then I move in order to be really comfortable with my arm, because all the strength of my arm goes in my hand. And even with a 60, this is a 60 millimeter, I can always take benefits in the cheek. So I said 3 mechanisms. The first mechanism is the Bunitral lift. Is first the mechanic of the cannula by itself that will defibrosis and started to enhance a new collagenase. Then second benefits is the benefits of the fine lines, which will hydrate and also induce neocollagenase. And then third benefits is the benefits of the NCTF 135HA, this solution of more than 59 ingredients with fruit shea, but also with all the vitamins, the antioxidants, the minerals, you know, all the amino acids, coenzymes that will really reboost the activities of the fibroblast and fight against aging and enhance immediately and in the long term the quality of skin. So now I finished one phase, half a phase I would say. And you know, our patients today want immediate results, no downsides, no side effects. They want immediate natural result, but also long-lasting. And here I just want to show you, maybe Capucine, you can sit down, vous asseoir, so we can appreciate the results. Here, to have a look. One phase treated and the others. Okay? So now I will prepare the plate for the other side. And
Dr. Philippon,
yeah.
We have a small question from the web. What kind of product you use to preserve the quality of the skin?
In the Bunitral lift, we take advantage of two kinds of different products. First, the fine line, which is low reticulation, 20 milligram HA. And second, we'll take advantage of the NCTF new cellular treatment factor, which is the core product of Filorga to treat it as 40 years old and to treat the quality of skin on two aspects, prevention and correction.
We have another question from Argentina this time.
Yes.
We have a live doctor who is asking, what's the plan of injection?
The plan of injection, this is an excellent question. Hello, Argentina. Was there 1 month ago. The plan of injection of the Bionit lift have to be superficial. That's why, when you inject, you remain very superficial. Fine lines is very smooth, very low reticulation. So if you do too deep, you won't have the benefits you can take if you remain superficial. You need to see, your cannula just under the skin.
We are staying in the South American zone with Peru this time, asking us why do you use cannula instead of the needle?
Another excellent question. Why do we use needle? First, because the needle, even if there are 1 inch, is 13 centimeter. So you will never take advantage, of the 60 millimeter to cover, a huge area in the face. That's the first point. And the second point, which may be also even though important, is that with needle, you will never have the safety you have with cannula. So you have a risk of hematosis. It's impossible to do it with cannula, with needle. You have to do it with cannula, to take advantage of the cannula by itself. That will defibrosis superficially, and that will also very safe. Because as you've seen, you may have at the entry point an hematoma. But if you manage very softly the cannula, and even if the cannula has the reputation to be safe, you have to remain very safe and not to go like what? Like too strong.
Before jumping back to our patient and the end of the treatment, we have a last one from Europe this time, the UK. Question being, after how long and how often do you see your patient post-treatment?
Well, I like to see my patient just 1 month after the Bionit lift, because in this case I do the duo, which is upper and lower vectors. But sometimes, for many reasons, we just do 1 vectors. And I like to see my patients back because I took the time to explain during the first, consultations that we can produce this Bionit lift in many areas of the face. So I always start what she wants in terms of her to be corrected. But after, and honestly, I started to work with this protocol since now 1 year, and I have so many good feedbacks that when they come, they told me, well, I want to do the lower part, or I want to do lips, or I want to do the forehead, or I want to do this part, because in fact, when you understand the protocol of Bionit lift, we don't mix, but we'll associate HA, low reticulation, with biorevitalization, taking advantage of correction of the shadows, of the wrinkles, of the treatment of the quality of the skin, and also the quality of the skin by the NCTF itself. You can imagine that you can use it everywhere. Also, it's not the case of Capucine. You can really, and it's very interesting, when you start from this point, treat all the lower part and the pli d'amertume, the marionette lines.
A very last one. Sorry to bother you, but we are assaulted with question. From the UK again. Question being, do you use the same protocols and the same products with women and men?
It depends. It depends at which grade of skin aging I'm facing. Concerning men, when they're consulting, well, in the case the one I had, the skin was very thick. And usually, most of the time, the thickness of the skin of the man are thicker than the woman. So I will use universal, but not too much. Half a syringe of universal for men. Then for the woman, it depends on the grade of aging. When the skin is very thin, maybe I would prefer, and very stretched by aging, maybe I will prefer to remain on fine lines using 1 ml and half a vial NCTF than universal. If I really have some deep wrinkles, I will use universal's half a vial.
Thank you a lot, doctor. And
Thank you.
The floor is yours.
Thank you. So I will reproduce, the same procedure on Capucine here. So first entry point determined by the length and where I want to treat. Here I will start, and I will take advantage of this ring to, not treat very important here, the high circle, but just this part, just to lower, to balance. Second part, I will take advantage to deposit a small drop here for the upper part of the nasoginal, second and fourth, and in beside, NCTF, okay? Second bionitrol lift using alpha syringe of, I will start here, taking advantage to treat this part, this part, this part, and immediately I will have a pimple effect, and at term, what I want to show you, it's not a lift effect like you can have with surgery, neither volume immediately, but you will have honestly this kind of effect. And that's why patients are really, and I can tell you from our experience, just 1 year after starting using this protocol, they are coming back. So I will proceed to another bionitrol lift. So first point, remain always very superficial with your entry point. Now take the same plan with your cannula, remain very superficial, very soft. Ça va, Capucine?
Oui.
Okay. Always maintain very soft pressure. If it's harmful, it means you are not in the right plan. I will deposit very slowly, and maybe you can see my product here, 0.1. Then you see my cannula is very superficial, and I take advantage of the cannula, to defibrosis also. I will put a little drop here. That's what I said, one also benefits of the bionitrol lift to correct the shadows. Very soft. Okay. Then the other fanning here, and you can make slight correction, on the upper lip. Then fourth one, and you can feel it cracks. Vous sentez que ça craque un peu? But it's okay. It's not uncomfortable. Okay. Last one. Here.
Dr. Philippon,
Yeah.
I'm rushing you with the questions from a doctor.
Yeah.
Is it possible to use this technique on another part of the face, and especially on the forehead?
Yeah. It's very interesting, especially in many cases. First cases, when the forehead is quite aging, with wrinkles and with loss of volume here, and patients don't want any toxin, it will allow, honestly, to have fantastic results, very natural, without toxin. And when it is very stressed, you can start with bionitrol lift, okay? In 2 points, I will draw you, if you want, where is. And after, do the toxin, if he's willing to. But it's very interesting.
Thank you, doctor.
Okay, so est-ce que je peux avoir un peu de biceptine, s'il te plaît?
Je vais vous demander comment est-ce que vous allez. I'm doing the live translation to ask the patient how is she feeling.
Je vais bien, ça va bien. Franchement, ça fait pas très très mal.
I'm good, I'm feeling very good, and it's not painful at all. Merci beaucoup. Thank you.
Okay, so now I will do the last part, the upper part, here. And you see here, I really want to start treating, this elastosis. So that's an excellent, indication of the unit live by itself. For example, in this case of Capucine, maybe I will ask her to come in 1 month, and if she's happy, to keep on going to do another one, either from there or either for the lips. Because really, I think it will enhance, and improve the firmness and the quality of her skin. So, I repeat the protocol. Remain very superficial. Take the time to do the pre-roll, very superficial. Change the cannula to the fine lines. Always important to start with the fine lines. Very often we do have question, why don't you mix the two? You won't have the same result if you mixed the two in the same syringe. When I mean mix the two products. Because, the rheology profile is totally different from a gel reticulated, even if it is low reticulation, low concentration, and with a biorevitalization. So you really need to start first with the fine lines and after to put inside with the NCTF. Are you okay? Mm-hmm. So look here, I take advantage of the length of the cannula also to start doing a little unit lip, but it will be good, in prevention for upper lip. Okay, 0.1. Then I will move here, start to treat here, 0.1. Then here, maintain very superficial, 0.1. And then 0.1. I don't remove my cannula. Oops. And I take the NCTF and just eject inside the fanning with the same techniques, NCTF 135HA. This will really enhance the quality on skin on an immediate basis and long-lasting results. Then after, I will make a massage and I will explain Capucine what I did for skin and what she will have immediately and at 6 months. And if she appreciates it, we could start from there. Also for the forehead, it's very excellent. Before to do the massage, I want to show you for the forehead where you can start. For example, you will use 0.5 ml of fine lines from there with these techniques, very interesting. On the inside you put the NCTF and another here. You have to take very into account for the forehead, the vascular, to be very, very soft. Okay, don't inject in this from this part here. Okay, and it's a bit more painful than on the cheek. Okay, so I will hand with a massage. I will use the B3 recovery cream from Skin Perfusion, which is a very good repair cream. And I explained something also important to my patients, that she will have to do some massage from the chin, to the cheek. Her concern was, to maintain a lift effect, and she was upset, by the lift contour and the oval. So with this massage, with the Bunit lift we did, honestly, I think she'll be very happy because she will have at the hand something very natural immediately, and that will be long-lasting on 12 to 18 months. In between, of course, you will be able to propose your patients some other area to treat, depending her needs and wish. Okay.
How do you feel?
Parfait.
Perfect. Needs no translation. Thanks a lot.
Thank you.
Thanks a lot, Dr. Philippon. It's an incredible result. Very happy to have you. Before going on the other session of the questions, please stay with us for a while. After a few minutes, we'll jump to a talk with the doctor with a couple of questions coming from the world. Thanks a lot, and see you in a few minutes. Hi, thanks a lot for staying with us and to be back. The first thing we're going to ask our patient is how she feels the results, and was it painful or not?
Parfait. Non, c'est vraiment pas douloureux, c'est presque agréable et le résultat vaut vraiment le coup. Donc c'est vraiment bien.
Okay, well, she feels very happy. The result is great, and I can confirm the result is awesome. Well done. She doesn't feel any pain, and pretty quick in the end, so very good cake. So my first question to Dr. Philippon, thanks a lot for being with us, is about the quantity that you use. Is it a matter of quantity? Is it a matter of technique? How do you feel?
What a very good understanding point to this protocol of Bunit lift, which is a protocol, an exclusive protocol from Filorga. When you use Bunit lift, you use fine lines in this case and NCTF. For each half face, I use one syringe of fine lines, one vial on NCTF. That means for the whole face, I use 2 syringes of fine lines, 2 vials of NCTF. What is very important to take advantage of this product is to remain superficial. And on the wall aspect, if we're talking about economic aspect, you have quite natural results with at least not such quantity of product. So as far as you maintain superficial, it is very interesting for patients, because the cost of the protocol is very affordable for them.
So it's a matter of technique.
Yes.
Dr. Philippon, what other techniques could you use to optimize the results of the treatment?
Other techniques. Well, to optimize the results for me is to see your patients, for example, 1 month after, and to see with her or him what she expects from, and maybe to propose another area with these techniques. That's, for me, how to maximize. But you can also, with the Bunit lift, propose another kind of treatment after, either mesotherapy to revitalize for the whole face and the neck and maybe the décolleté, or toxin if she wants for a face, or whatever, enhancement of the lips. You can totally use Bunit lift by itself or combine to any other kind of treatments.
Inevitably, we had the question from South America, Europe, the North America as well continent, about what potential complication can you have after such treatment, and how do you deal with them?
Well, the complication you can have is like for any injection, especially with the entry point, with the needle, you can't never know if you will not meet any vasculars and do a bruise. That's the first complication. It's immediate. Then after, I think with the cannula, even if you are superficial and we don't face any danger, anatomic danger, either vascular or nerve, as far as your patient is do not feel comfortable, is painful, you have to stop and to change the plan of your cannula and always to remain very soft. That's a major point. Another danger is not to go too superficial, on the lower eyelid. Always remain, on the inferior border, here. If you go too superficial to deposit some fine lines in the lower eyelid, you will risk to have a swelling and edema. So you have to remain, at the inferior border of the lower eyelid.
So we have a question making a lot of sense given the audience. Doctor, do you think that this technique can be used on any type of skin?
Yes. Any type of skin, excepting, of course, because it is HA reticulated HA, the contraindication of the use of fillers, that is to say autoimmune disease, especially concerning the skin that are active or patient under immunosuppressive therapy or pregnancy or breastfeeding, or that's mainly, the major contraindication.
And if the geographical region is concerned, would you use the same technique on Asian patients, on African patients, on South American patients?
Oh yes, I've already used on all type of phototype, honestly, men and women, and Chinese people also are very happy because what is magic? At any age, you can consider punit leaf as a prevention treatment for the young woman or men when they just want, to prevent from sagging and to treat quality of skin, or for mature women like Capucine, where you will use more product and 2 entry points.
So one last question is, can you remind us of the benefits of such treatment for your patients?
Well, the benefits of this kind of protocol of the punit lift is to offer patients in one single session with only one single entry point, so I will say minimal size down, an immediate effect of really fresher and blooming effect. And that will be more and more improved over time, in terms of lifting and in terms also of quality of skin. What is very interesting for the patient is that she will be immediately satisfied and on a long-lasting point of view also.
Do you use the Bio-Nutrilift treatment for the barcode above the lips?
Yes, that's amazing. So here when we were talking about product, for the barcode, you need to use, I would say, not a 60 millimeter, but at least either a 40 or 55. And what is very important, you can take benefits of this technique to, how would I say, with the lidocaine inside the fine lines, to anesthesia first of all, and to treat even, the upper part of the nasogeneal part. And here, if it is very stressed, very marked, you can use universal on the lower part, but never use universal on the upper lift. It will be too big. But it is fantastic because after, you can, if the barcode was too important here, just complete your correction with the needle by itself, with the fine lines.
Okay, so I understand that you would be mainly cannula and then needle.
Yes, especially if you have some more, either in the same session or 1 month after to complete. But to start, with this fanning technique, using fine lines and in between NCTF, you have some very natural and what expect patients.
From your experience, how long does the effect last usually?
I started, to be very honest, just 3 months ago, the punit lips. And the lips due to the orbicularis is more sensitive region, and was HA is degraded more rapidly. So maybe it will be less long-lasting than on the cheek or on the oval, but immediately, and I will say for 6 months at least, it could be good, very interesting.
Question. We know that PRP technique is not authorized in France, but globally speaking, would you think it would be a good combination with the Bionutrilift treatment?
Oh, yes, I'm convinced. Sure. And what is very important, thank you to your question, Quentin, is that Bionutrilift can be combined, for example, with peeling before and with fillers after, or why not PRP or biorevitalization, And it can be combined, of course, with volumetry. Maybe mainly you will start with the volumetry and after enhanced, with Bionutrilift. And it's also a very good treatment, I would say, to maintain close relationship with a patient on a regular basis in order to enhance the quality of skin and sagging. Because as you may know, the major concern and expectations of women is to fight against aging, and mainly on 2 points, sagging and wrinkles and quality of skin. So here you will really, match all expectations of women.
Do you use it as well for the neck treatments?
Not yet, because neck is a bit, would I say, tricky. You need a 70 gauge cannula, but it can be used, or by a 60 with exactly the same, but you have really to be cautious on the neck and knows very well the anatomy, respecting, the vascular, the veins, etc. But you can use it, very interesting also, for the décolleté. Here it is safer. I would say that for the neck, maybe it is a more tricky area. I wouldn't advise to start, even if neck needs lift and hydration and better quality of skin. I will not start with this area.
I know. What technique would you use for the neck before going to the décolleté?
For me, personally, I like to use the needle, and to deposit some small drop of a combination of AMHA 18 plus NCTF 135 HA. So I have 4 ml, and I use this protocol 3 times, especially during winter time, because my patients don't have, it remains papular for 2 minutes, for 2 days, sorry, not 2 minutes, but not long lasting, and because it is free HA, and I like it very much. And I start the neck as soon as I have dehydration, symptoms.
The main product you used tonight was Fine Line and Universal.
Yeah.
Can you remind us the differences in terms of composition and in terms of use?
Well, the product we used tonight was Fine Lines, 20 milligram HA, slow reticulation, and quite important percentage of free HA. It sounds very interesting in superficial because the integration of the tissue is excellent. You won't have any bump, as you can see. It is very natural, and it will have an immediate and long-lasting effect. Concerning Universal, I didn't use it on Capucine tonight. It is more reticulated, but we've been talking about it is 25 milligram concentration, more reticulated. But even so, very interesting for thick, and honestly this part here, but not on the upper lid. Concerning the biorevitalization product we used, it is the NCTF 135 HA presented in vials of 3 ml with 5 milligram concentration of free HA plus 59 ingredients mixed in vitamins, amino acids, coenzymes, and antioxidants. All the major nutrition for the skin.
We have to admit that we've been very impressed by your expert use of the cannula. It's a complicated technique, and loads of doctors who unfortunately not have yet your experience are sometimes, I would say, a bit scared to use it. So what piece of advice would you give them in the use of the cannula?
First of all, I would say I think it is less dangerous to use cannula superficial than deep, because when you use cannula for volume, you have to be right, in the good plan. Here, you are in the good plan because the key point is to maintain to see your cannula under the skin. Then, so there is no danger. The danger is to go too quickly and too abruptly, and you'd have to avoid if it's in 25 gauge here. One thing's very important, you have to use a 25 gauge cannula. 25 gauge, that's it. So I would say that you have to remain very superficial, and the best way is really to achieve to be very quiet on the entry point with your needle. And as far, as you create a kind of tunnel with the entry point of the needle, be very smooth, relax, and help your cannula to get in. Sometimes, if you feel that you have a kind of obstacle, what you can do is just to push a little the fine lines with lidocaine and after to gain. You never have your cannula to be like this curve. Your cannula always have to be tangential to the skin like this and smooth.
We have a question from Paris this time about the hands. Would you use the procedure for the hands? And if so, could you show us on our patient how and what technique would you use?
Excellent question from Paris. Thank you, French. So I'm going to show you. I love to treat hands like neck and décolleté, because sometimes when you feel to be very well, in good health here, if you have some bad hands and neck and décolleté, well, it means you are not really well balanced. So it's very easy. Hands, you have to remain superficial because, and you have to use cannula. You will do one entry point. And for example, I will take my cannula like this. 60 gauge is excellent. So you will have to determine your entry point. For example, using first where you wanted to treat. Here I will go there, for example, in my entry point, And I will use universal, that is, because there is a bit loss of volume. And I will use 1.2 of universal and 3 ml of NCTF. It will make 4.2 ml. I will use half a volume here, half a volume here. Entry point, always very tangential. And then after, you just deposit your product in between very slowly, and you always make a massage like this. And it is very nice.
Dr. Philippon, thank you very much.
It was a pleasure.
Being our host tonight. Muchas gracias, Dr. Philippon, para esta noche. Thanks a lot to our audience. Each time even greater in terms of number of people and in terms of geographies. It's a great pleasure to have you. The next meeting will be on the 29th of May, 8:30 p.m. Paris time, about intimate regions treatments. We hope to see you numerous. We will take time to answer all the questions we didn't have to answer during the live on the website. Please don't hesitate to contact us. And, we'll be happy to see you next time, 29th of May, 8:30 p.m. Paris time. Thanks again, Doctor. Madame, merci beaucoup. Au revoir.